Today we will be talking about complementary and alternative medicine, CAM for short, specifically in the ICU setting. What is CAM? Contemporary and alternative medicines are generally defined as the use of non-allopathic remedies that typically fall outside of traditional formal healthcare practices. Some examples of CAM include meditation, music therapy, guided imagery, pet visitation, acupuncture, massage therapy, light therapy, herbal remedies, and so many more. The list can go on and on. Nurses have a critical role in implementing these strategies in the ICU setting. The nurse's perceptions of the legitimacy, efficacy, and benefits of CAM affects his or her desire to introduce these contemporary techniques and the patient's satisfaction with the mechanism. Routine assessment and active recognition are the basis of CAM, followed by implementation and assistance with the use of delegation. Personal education and patient education are both vital in CAM use. And finally, advocacy, which can be very difficult in the ICU setting. There are a number of barriers to the uses of CAM in the ICU settings, including lack of education for nurses and patients on CAM therapies, many negative attitudes towards non-traditional therapies from medical and nursing professionals, ethical issues related to little scientific evidence supporting the use of CAM, and lack of equipment, time, or training for those who could be providing the therapies. In a stressful ICU environment, it can be difficult to engage in calming therapies for both patients and nurses. Some examples of practical ways to implement CAM include pamphlets and handouts, a CAM cart, which could include things such as light therapy, music players, meditation CDs, aromatherapy, and so much more. Staff education, which would allow staff to experience these therapies firsthand and supplement them with traditional medicine, and to start the discussion early. More time should be spent discussing, learning, and researching CAM as early as nursing school.
What is it, Mrs. Mabel? I have two really critical patients right now. One of them is about to code. What's wrong?
I'm just in so much pain.
Are you crying? Okay, well, I'll give you pain medication, but are the lights bright? I can't deal with this right now. I'm sorry. I need to go check on my other patient. Hi, Miss Mabel. How are you doing right now?
I'm not doing so good. I'm in a lot of pain and I'm uncomfortable and the lights are really bright.
Oh, well, let me go dim the lights for you real quick, and then I'll help you get more comfortable. So you said you're in pain?
Yes, on my right hip.
So your pain meds aren't due for a couple more hours, but I can make you feel more comfortable and do some soothing things that can distract you from the pain. What area is hurting you?
Right over here. Could you?
Yeah. Can you lean on that side for me? Let me just reposition a little bit. Would you like one under your back?
Yes, please.
There you go. Is that a little better?
Yes.
Okay. And how about I turn on a little bit of music for you that'll kind of make you release some endorphins and feel a little bit more relaxed?
Yeah,
Does
that sounds
good?
really great.
Alrighty. Is that a little better?
Yeah, that actually is nice.
And if you want to try a few deep breathing exercises, that might make you feel a little bit better as well. Just deep breaths in and out. Okay. And I'll be back in a few minutes to check on you and see if you're doing any better.
Okay, thank you,
Sound
Nurse
good?
Annie.
Uh-huh.